I'd like to talk to you today about heel pain, plantar fasciitis, and a certain techniques that's generally used to treat plantar fasciitis. One of those is actually utilising low-dye taping. Low-dye taping is quite an effective technique. I use it quite frequently within my clinic, and I get some very good response from the low-dye taping in regards as a short-term measure for treating the foot. Now, low-dye taping, a number of research has demonstrated the effectiveness of low-dye taping with regards to controlling rear foot eversion, supination, pronation of the foot, also reducing peak pressure underneath the medial calc, particularly in patients with plantar fasciitis and general heel pain. It will also allow the patient to put pressure onto the foot generally when they're actually walking. So you find when they start to walk, you find the heel strike that much better once you've actually applied the tape. So overall, it's also been demonstrated to significantly reduce pain, and particularly when compared with other treatment modalities. So if you're not utilising orthotics, it is quite good to use that when treating general foot problems. The application of it is quite straightforward. You can actually use 1 centimetre, 1.5 centimetre to 2 centimetre taping. Non-stretch taping is normally generally used, and find that more effective. Some of you may well use kinesio tape, but I find the sports tape is going to be that much better, less stretching, and give the foot that much more support. Do ensure you've got a nice sharp pair of scissors when actually applying it. So the actual application of it, start from the outside of the foot, and you apply 2 anchor tapes starting from the 5th, just proximal to the 5th metatarsal phalangeal joint. You'll take it around the foot in itself and anchor it just proximal to the 1st metatarsal phalangeal joint. So you'll do 2 strips of that. Following that, you'll take it from the lateral posterior side of the heel, and you'll take it under the heel and take it across to the 1st metatarsal phalangeal joint. And you'll then take one from the posterior medial side of the heel, and you'll take it across underneath the heel, across the foot to proximal to the 5th metatarsal phalangeal joint. It is important that you contour the tape into the medial longitudinal arch when actually applying the low-dye taping, and make sure that it's not pulled tight and the tape isn't actually adhering to the actual foot. So it is important that you do make sure you get a good firm sticking of the actual tape itself. The patient's going to find it that much more comfortable when they start to stand up. Following that, you're going to put more anchoring tape and take one from the lateral to the medial side of the foot and pull in slightly tight on the medial side up into the medial longitudinal arch. That will be overlapped and taken from starting at the metatarsal phalangeal joint and taking it right the way back to the heel. And again, pulling tight on the medial longitudinal arch and make sure it is contouring into those spaces. Now, if you want to get more control, then once you start to get towards the posterior side of the medial longitudinal arch, more towards the heel, then you can start to take that further up in and around the ankle. And that's been shown to give the foot that much more control, particularly when it comes to pronation of the actual foot itself. So generally, overall, you normally leave that in place for about approximately 3 days. However, if you've got an athlete who's actually going out to actually participate in any event, generally research will show that taping will have an effect up to 20 minutes, and low-dye taping will generally have an effect up to that similar time period, so it can alleviate some of the stress that's going to be put upon the foot up to that time period. So at least it will take off some of the strain. But again, it depends on the intensity of the activity, but however, you're putting something there that's going to assist. So other important thing is to put an anchor. So I normally put an anchor over the top. I normally use Meadfix. It's quite flexible, and again, they don't get much irritation from that with it going over the top of the foot. The other important thing is when you come to take it off, is do make sure that they soak the foot, because I have known it to peel the skin if it's left on for too long, and that's somebody who actually left it on for approximately 2 weeks before they took it off. And again, if you leave it for 24 hours, after 24 hours they can get it wet. So that's not main concern. If somebody's going to leave it on for more than a day, ask them to keep it dry for 24 hours, and then after that they can take it off. Thank you for listening. I hope you find that of use within your practice, particularly those of you who's working with the sports people, but then it's just as effective with the general public. Thank you for listening, and I hope to see you again very soon.